So I came across an interesting case today. Patient came in primarily because of low back pain. So let's go here. History: low back pain has been occurring for years. Neck and upper back area is pretty bad as well. Low back is more stiff in the morning. Neck's also stiff in the morning. He sleeps well, but the neck pain can be bad and wake patient up at times. The pain is deep, achy, but can also be sharp at times when it comes to low back. Aggravations for his low back is sitting for a prolonged period. Eases: a standing desk, gym, and stretching. So those are things that kind of help. When it comes to work situation, he's sitting a lot. Other therapies tried is chirophysiotherapy. IMS works really well for him. So that's when the patient identifies that IMS works, that's something we got to take into consideration when it comes to treatment. When it comes to past medical history, IBS. Doesn't see any correlation with low back pain. Also, when he was 4 years old, he had a heart surgery, which affected, there's a scar on his left shoulder. Also, at some point, he had a bulged disc in the lumbar region. He doesn't know which segments. As per MRI that he took, it was quite bad. He had a bad flare up after being on a plane for prolonged periods, and as a result of that, he decided to get an MRI, and that's what it showed. The X-ray didn't really show anything. Okay, so basically, this is the patient. We're having the patient. I had him tested standing on the right versus the left. So let's start with the right. You can see he looks a lot more symmetrical when he's standing on the right. One of the things that he can work on a little bit is his glute strength. You can see he's shifting quite a bit laterally. Now let's go into the left here. So as soon as he stands on that left leg, he tends to compensate quite a bit. And it's almost as if he's even. Let's start with the right leg. You can see he's bringing it up a little bit more. You can see this right leg when he's standing on the left is actually a little bit more flexed than when he's standing on the right, the left leg. It's a little bit more relaxed, whereas this one's a little bit more flexed and a little bit more forward, which probably indicates that he's using potentially his hip flexors and his psoas muscles to stabilize his body while he's standing on this left leg, as well as this QL. So that's one thing that I've observed. Now let's go back up into the upper quadrants. When it comes to on the right side, you can see this right shoulder is quite a bit lower, so there's quite a bit of asymmetry when he's standing on the left versus the right. And then also the left shoulder is quite a bit higher. It almost seems like he's trying to compensate once again with his upper extremity for the weakness in the left hip. And as a result of that, this could give you an indication that there's probably something going on in this left upper quadrant, especially if when he's walking. He's doing this every time he steps on this left leg. So that's something definitely on observation you got to try and take into account. And there is a little bit of a side flexion. You can see in this quadrant here versus this quadrant, there's a lot more of that side shift when you compare it to the right versus the left. So there's quite a bit of a side shift there. And also a big thing here is the scar. So that's something to take into consideration when it comes to treating. I'm looking here. There's maybe a little bit of a Trendelenburg there, more so than on the right. It's not as noticeable because I think he's compensating with other parts of his body quite a bit. So once again, there's quite a bit of a lateral shift. If you compare it to the sides, the left one his left hip is more laterally shifted. So these are some of the things to take into consideration when doing your observation. Obviously, you can get the patient just standing, but in this case, I had him standing on one leg as well. So because that gives me a really clear indication as to how his body's behaving when he's standing on that one leg. And just based on these tests, I can even before doing any testing, I can see that there's something going on with this left lower quadrant. So on my observation, Left shoulder is a lot higher. Left hip seems like it's weaker. Right hip is sitting higher when the patient's prone, so it could be that QL and the psoas muscle are pulling it up quite a bit more. When it comes to range of motion, there's on the grind test, there's a pain into the low back, which once again indicates that there's probably some hip flexor stuff going on that needs to be sorted out. When it comes to strength, the left hip is a lot weaker. There's really no push. There's no push against my arm when I am side-lying, when I'm doing the side-lying test, whereas the right hip, there is some contraction, but it could be a little bit better. And once again, that's shown in that single leg stance. I can see that his ability to control the rest of his body with the hip muscles and stabilize is not there. When it comes to special tests, the left Faber is about 2 times the right, so it's quite positive, and the left straight leg raise is about 3/4 the right, with pain occurring in the leg and all the way down the leg. And on trigger points, some of the trigger points that are found is lumbar erectors, both sides, left rotator cuff, quite a bit of shooting right down into the arm, numbness into the elbow. Groin on the left side is very, very tense and tender compared to the right. And the reason why that could be is because that groin is most likely compensating for the weakness of the left abductors. So as a result of that, his way of stabilizing when he's standing on that left leg is to use the groin muscles extensively. Now the problem with this is in the long run is that left hip, with the groin muscles pulling the way they are, they're going to cause more hip compression, which is going to lead to higher chance of getting arthritis, and also big trigger point in the left hamstring. And also bilateral, especially shooting pain down. There's more mass on the right glute muscles, but there's more trigger points that are shooting down the leg and even potentially causing some numbness down from the gluteus medius. Just based on the testing so far, it leads me to believe he's probably got a disc bulge at L4, L5, just because that gluteus medius is really not firing too well. But then again, the left hamstring is also quite sensitive, which is more indicative of L5S1. So it's kind of hard. Based on this, it is difficult to determine. Treatment-wise, so I got right into it. Treatment-wise, I did a lot of trigger points, stuff to the left groin, and I remembered to give him some groin stretches, maybe just add a groin stretch, a part of his program. I did trigger points to left rotator cuff. Once again, quite a bit of referral into the shoulder and down the arm. Also trigger point down the left side of the neck. Once again, quite a bit of tension. And it's understandable why when he's standing on that left leg, he's lifting that left shoulder quite a bit higher, and as a result of that, what that leads to is compression in the neck area, and also the extensive use of neck muscles, even when walking. Did trigger points to bilateral hips. Once again, quite a bit of tenderness. More meat is on the right side, obviously, which indicates that there's quite a bit of atrophy on the left side. Trigger point to lumbar erectors. When I did do the trigger points therapy to the lumbar erectors, what I've identified is that there's some pain and going right through into the stomach, which indicates once again that there's probably some disc stuff going on. Once again, trigger point to left hamstring. Left hamstring was very, very sensitive compared to the right. And then what I did after I did the trigger point stuff, he already felt a lot better. So then I followed up with some IMS to bilateral lumbar erectors, targeted longissimus, iliocostalis, and multifidus, all 3 of them. It seems like probably that L4, L5 area, there was quite a bit of twitching on the left side, specifically around the longissimus. IMS to left hamstring, did IMS to left teres minor, infraspinatus as well. Left hamstring was twitching. Teres minor was twitching quite a bit. IMS to bilateral traps, and also I did IMS, I didn't write it here, but to the left lat, and that left lat was just twitching quite heavy, and that's probably because there's quite a bit of dysfunction there as a result of that surgery. So anytime you see those scars, you kind of want to try and target that area and target that muscle and see how well it's doing. Plan for this patient is to work on left hip strengthening in the long run. Why is that? Well, because if that left hip continues to stay weak, doesn't we don't get that pinpoint strengthening, what's going to happen, there's going to be a higher chance of that left hip degrading and obviously arthritis setting in. So we really got to work on the left hip strengthening. I added some left groin foam rolling, and then also we're going to probably look at some left shoulder strengthening, although I think left hip strengthening is more important at this point, which is the stuff that I sent him. And the left hip strengthening is going to be non-weight bearing, simple stuff, nothing too complicated, and just a lot of repetition, and try to get a good burn out of those muscles in the left glute. And yeah, that's about it. So we'll see. And once again, the goal with this patient, I mean, it'll probably take, on and off work for about 24 months for something like this, because it is quite chronic. It's been going on for years. So don't expect, quick miracles, and that's what I say to my patients. So yeah, hopefully after a session he was doing quite well and he was quite pleased with the session, so he booked for another one next week, and we'll keep plugging away with it.